Petra Beumer, clinical psychologist, has been in town for a while. We've worked with her over the years, and she's really seems to have changed her program significantly recently. And I would say the focus is being kind to yourself and being gentle and being mindful.
Yeah, I think it's great. She's working in the type of therapy she does to patients that have a little bit of a difficult relationship with food, like yourself with sugar.
Really?
Anyway, it was a great episode.
It was.
So we hope you enjoy it.
It was very helpful.
Yes, it was.
But what do I know? I'm just a vagina doctor. Petra Beumer, welcome to the Vagina Doctor podcast.
Thank you.
Really
Good to be here.
Great to have you here today.
Thanks so much.
You have a master's degree in clinical psychology.
I got that many years ago in Hamburg, Germany.
Yeah. Nice city, Hamburg.
Yes.
And you have decades of experience in promoting positive lifestyles using both Eastern and Western therapeutic approaches. Mainly in the realm of emotional eating.
Yes.
Weight management, self-care. We've worked together in the past, helping patients in their weight loss program. But tell our listeners about your practice now.
Yeah. Again, thanks for having me. I used to be a weight loss coach for Sansom Clinic, and I was a very different person then and a very different therapist. I no longer believe in strict dieting and rules and obsession about weighing food or counting calories. We did all this then. It was a behavior change model, and emotional eating was not addressed. So in our long-term weight management phase, my patients would gain weight back. Of course, because emotional eating was not addressed, they would say life happens. And then, of course, they would fall back into familiar coping patterns.
Yeah.
And so I had the courage to leave the clinic in 2017 and start my own business, the Mindful Eating Institute. And I now help clients let go of the need to self-regulate with food or numbing with food, and replacing that with self-nurturing and more life-giving patterns. And that is a deeper dive. And it goes beyond lifestyle changes. You know, some people only need a lifestyle change. That is very different. Then you bring in cognitive restructuring, having a plan and goal setting. But the majority of my clients had trauma growing up, either emotional neglect or abuse. And then food became a comforter and helped them get through life for years and years and years. So it takes a while to uncover that and help them heal. And it takes minimum of 6 months to a year in many cases.
And how frequently are you working with the clients under those
So I
circumstances?
accept clients for a minimum of 3 months only. There is no quick fix in my program. So we meet once a week. Well, the intake session is 2 hours, and then we meet once a week for an hour. And I got a text from a client this morning. They texted me in between sessions, and she said, I had a dream about sugar. She has a sugar addiction, so we're working on that, and that has been going on for many years. So they get in between session text support as well.
Tell me about sugar addictions.
Oh boy. So I'm not a nutritionist. All I know, oh, there's a connection.
Really?
Well, I know there is now a change in your neurochemistry, and I treat it like an addiction. I taught smoking cessation for the neighborhood clinics for 6 years, and I feel nicotine is worse than sugar, but sugar is hefty. It's not easy to beat. You need to address it again with gentle curiosity. Don't beat yourself up, and replace it gently over time with healthier alternatives. So I'm weaning her off processed sugar. She's still eating other sugars. And I got a long text this morning. I haven't had a chance to read it, that she finds her relationship with sugar to be toxic. And understanding the need. Why am I reaching for this? How am I feeling? Am I stressed? Am I worried? Am I bored? Am I trying to take the edge off? It's like others maybe drink another glass of wine, that extra glass of wine. So my job as the therapist is to help uncover the true need. What am I needing in this moment? As if I were soothing a little boy or a little girl. Say, honey, you had your cookies, enough? What's going on? Come, we'll sit together. Tell me about it. And teaching adults to be their own good parent is what I do. Working with the inner child, that's a term in psychology that has been overused, but I feel it is critical to heal your relationship. Mm-hmm.
But what is it a lot of the time with sugar? Like, what do people say that they're feeling in that moment when they grab sugar?
Well, for example, one of my clients had a procedure at a doctor's office that was pretty nerve-wracking, and then she hit the bakery afterwards. So it can be a reward. It can be a thing to take the edge off.
Or if maybe are they just still hungry? Have they not eaten enough?
Of course, that could be too.
Like,
yes.
Are they not eating enough so then they can eat sugar? So they have room? Or like
no, sugar goes,
it's first.
And every client, I don't have a cookie cutter, forgive the pun, cookie cutter recipe for the sugar thing. There are many, many layers, and that is my skill, that I help clients uncover their relationship with food. That's the first question I ask in intake. Right. Describe your relationship with food. And one of my newer clients said, dangerous. She's somebody who had bariatric surgery and has kept 120 pounds off and is still not completely at peace. So you could have a person like you, Karen, perfect body, sitting in my chair at war with food from morning to night. So I don't just get people who are overweight.
Yeah.
Mm-hmm.
So you can eat right all day, exercise like crazy, and still have issues. Mm-hmm. So the whole body image thing is so important, and embracing our bodies. I was introduced to the concept and research of Dr. Kristen Neff. She has a website, selfcompassion.org. It was a game changer for me, for myself, and also for my clients. So I teach self-compassion, and what that is acknowledging suffering and pain and having kindness with ourselves and touching our hearts and say, this is a tough moment. Bridging that with the eating and overeating, if a client, and this is for the listeners, the golden key is if one can build in a mindful pause before reaching for a snack, sugar, third glass of wine. And it's not easy to do because the impulse can be strong, but if you can pause and just investigate for a moment, what's going on here?
Right.
Am I hungry, or am I just stressed or lonely? And then taking care of that true core need. That is what I teach. And that you cannot unlearn, which is the beautiful thing. The people don't have to keep coming back to me years and years later because it will have been integrated in their psyche. That's what I'm finding.
For me, I feel like I have a sugar addiction.
Okay.
And
a third glass of wine addiction.
Which there's a lot of sugar in that too.
But that's, yeah. Right.
Well, thank you for being so open about that.
It's
no, he doesn't do that all the time. I'm just saying that it is sugar too, as well. The third glass of wine,
but it's actually with the sugar, it's a craving.
Yes.
Yeah. Okay.
How long has this been going on?
All my life.
Since what age?
As long as I can remember.
Really?
My grandmother had basically a candy store.
Okay.
So I grew up with it. And in the time in England when we were rationing and chocolate and other things were not forthcoming initially, but to me it was always there. And I remember one of the greatest birthday presents I ever had was this box of Cadbury's milk chocolate bars, and there were like 20 of them in there. maybe it would have been 24. But,
so
it was that was an incredible present, and so it's a fight for me.
Okay, how can we turn that fight into more like a healing attempt? Is it okay if I use you as a...
Yeah, sure. I mean,
so let's say there's a fourth chair and sugar is sitting there, right? So what I would recommend is that you start dialoguing with sugar and saying, hey, what do you want from me? There you are again. Sugar says, of course, can't get away from me. We've been together for 40, 50, 60 years. And exploring your relationship with that substance as if you were looking at a relationship with an individual.
Wow, okay.
I mean, this is the psychology I bring in, and it does work. My clients dialogue with sugar. It's very interesting. And of course, there's more than just the sugar stuff. There are many, many other elements of emotional eating. And do you know what it does for you? How do you feel? Like, describe the first moment you have something in your mouth that is sweet.
It's great.
Yeah. What, like happiness? What do you feel?
Yeah, I would say that's.
Yeah.
Or maybe it reminds you too of your childhood.
Yeah.
Could be.
Could be.
I'm just guessing.
Yeah. And food, I mean, this is a question in my intake form. How was food and eating treated in your family of origin? That is so important, right? So in your case, if grandma had a candy store, that...
Exactly.
Yeah.
And I notice you do it when no one's in the kitchen with you.
Ah.
Really? Okay.
I'll just see that you've been into stuff.
Well, I'm into stuff all the time.
I know.
But is it harming you? You look fantastic.
I know, he does.
Is it harming you? Or why is this an issue?
Right.
Because my blood sugar is higher, is generally higher than it should be. So it's
but not much. It's barely.
But he's not at peace with it. That's what I'm hearing.
You're right.
Yeah.
So I wrote a blog post once based on a true client case study. She was addicted to sugar too, and she would do it in the kitchen like he does, And after working together for a while, she realized, and this is a true story, do I need chocolate or a hug? And she realized, I need a hug. She went over to where her husband was sitting in the living room and said, can we cuddle?
We could try this.
Karen will get a lot of love out of this.
There's lots of needs in my house. So now it'll be just one more.
Just one more.
So I'm just thinking, don't fight it. Become...
Just eat it.
No.
Or hug it.
Hug it? No.
Hug the dog.
If you had if I gave you a foster boy, 7 years, he's British, just came over, and that kid loves sugar. And you're concerned because his doctor told you, just keep an eye on him. His blood sugar for his age is getting a little bit too elevated. How would you help that kid reroute the cravings? Would you just say, go ahead, it doesn't matter? Or what would you do?
I would just try to control the amount and the frequency, and in that moment.
Okay, how would you control the amount without scaring the kid? Like what tone of voice, what intent? Like
No. I don't think it has to be brutal or unkind. It just has to be advice, reminding, suggesting.
Like what would you say?
Let's see.
It's not easy. Sometimes we don't know.
Yeah.
But they're so vulnerable. The kids look to us for advice,
Just, I think saying, okay, that's enough now.
That's enough, exactly,
okay.
With a kind voice, yes.
Yeah. And
let's do something else.
Yeah.
Yeah, come on, let's go outside. Let's jump on the trampoline. Let's play.
Yeah, let's play. Let's go outdoors. And also saying, I understand. It's so tasty. I know. I love it too.
Yeah.
So there are two aspects of self-compassion that Dr. Kristen Neff promotes. There is gentle self-compassion, like, oh, I understand, I'm sorry you're hurting. And then there's fierce self-compassion, like a fierce mama bear or papa bear would say, enough, setting boundaries. And that's a form of self-love and self-protection too, to just say enough. And we can do that as adults.
Yeah.
The other, when I want a glass of wine, sometimes after a long day and I'm exhausted mentally, and I say, oh, I want to go to Honor Bar. I want to have a glass of wine and French fries. And then I park my car, I'm not kidding, and sit with it for a moment and think, do I really need alcohol and French fries? Then I go home, take a bath, and do something else. Doesn't always work.
Okay.
But pausing is critical. And like I said, understanding, taking that deeper dive into the true need, which was relaxation, unplugging, and downshifting. And speaking of alcohol, there's more and more research on how dangerous it is to drink. I basically stopped. My brain doesn't like it anyway. So I'm just inviting listeners to be really mindful. So mindful drinking is also part of the program. And I love eating. I like good meals, and I would say I'm a hedonist, and I understand that some people have relied on food as mood regulator for decades. So we can't just rip that Band-Aid off within a few sessions and give them a diet plan. We're not serving that person. And over time, I see a shift in how they treat themselves, my clients. They set better boundaries. They say no when it feels wrong. They put themselves first in line for their self-care. And that is not selfishness. I just wrote an article for Authority magazine, which is part of Medium, the blogs where you can post. So I wrote 3,000 words within a few hours. It just came out. And the topic was how to learn to finally love yourself. And loving yourself is not being narcissistic or egotistical. It's honoring our true needs and then communicating those needs and standing in your truth. A lot of my clients are not used to saying what's really on their mind. And and then when they get resentful, they may overeat because they didn't follow their heart or their truth.
Slightly changing the subject. My weight management program in the office has changed significantly recently.
Okay.
All because of semaglutide and tirzepatide. What have you found? And what do you think about that?
Great question.
Weight loss.
It needs to be addressed. And I wrote a scholarly article about this on LinkedIn. I feel if it gives somebody a foundation and gives them the opportunity to free themselves from the food addiction, I would say GLP-1 agonists like Ozempic, Wegovy, or even Rybelsus are good strategies, but not a go-to strategies for somebody who wants to lose maybe 5 or 10 pounds for cosmetic reasons. That is my take. I would not judge this. I have 2 clients on GLP-1 medications, and they love it. I recommend, if you really want to learn the long-term connection with food and your body, it's a good choice, and it helps people get healthier quickly. But if you want to solidify those healthy long-term behaviors, I recommend adding a little self-promotion, adding my counseling services. To round that up, to give it a holistic approach. So there is, again, no cookie cutter recipe. If the doctor feels it's right, I trust that.
I think using it, I have that thought a lot with our weight patients. Like, there's the people that just take the drug. They don't change anything else.
Yes.
Right? They're losing weight. Then there's the people that are taking the medication. They're upping their protein at each meal. They're doing weight-bearing exercises suddenly for the first time in their life.
Right.
They're really committing to the process.
Yes.
And for those people to also work in a program like yours would be really beneficial.
Yeah, it really...
because then they could come off it or wean off it or microdose.
See, that's the key, to come off eventually, probably, and then just having a natural, healthy relationship with food. And why are you laughing?
I was like...
I was just looking at her.
Yeah.
I like looking at her.
Of course, I don't know. I see why. So, agreed. And so my program could be instead of. I met with a diabetes researcher here in town, Dr. David Kerr, and he said, Petra, you are instead of Ozempic. And I said, well, wait a minute. I could be instead of Ozempic or in addition to. Why not?
Right. Why not? If those, because sometimes people need that medication.
Correct.
To make a big difference suddenly, to get them to then go to the next level, right?
Absolutely, yes. Yeah. 100%.
If somebody's holding on to that, especially that for our patients, that they were fine, they were doing everything correct and went through menopause and suddenly have 10 extra pounds for no reason, right? And it's not, maybe it doesn't even show up as weight, it's just a distribution, not on the scale. Yes. Okay, so for those people, and we have a lot of those people, this has been a great thing.
Of course. Yeah. Yes.
But to also work it in with the relationship they have with food.
It really depends on the individual, and I do get, most of my clients come from doctor referrals from concierge doctors here in town. And for me, it's not just a passion, it's really a calling. Because I have done that inner healing work myself, not with food, but with the whole loving yourself part. And that's a big deal to finally come home to yourself at a certain age.
Yeah.
You know what I mean, right?
Yeah.
Yeah.
Definitely.
So, yeah.
You also mentioned using both Eastern and Western philosophies in what you're doing.
Great question. Thank you. I meditate with all my clients in the beginning of each session, and they get homework assignments or practices, which is meditate regularly. Start with 1 to 3 minutes a day. They can use Headspace or Calm or UCLA Mindful. And so that's the Eastern component. I love Buddhist teachings as well. I'm not a religious person, but I love Buddhist philosophy. And coming back to the self-love and self-compassion aspect is when we're hurting and beating ourselves up afterwards. For example, somebody eats a whole pizza and has 3 beers. And say, God, why did I do this? I'm already overweight. I almost said fat, which is a horrible word. But
that's what we say.
We say it. We
do. I say it to myself. I don't say overweight. I say fat.
Yeah.
So that's just realistic.
You're like a nymph. You look like a beautiful elf.
Oh my God.
You have nothing to worry about. So the point is, don't throw the second arrow. That's what the Buddhists say. You're already suffering. Don't throw the second arrow and hurt yourself more. These are teachings. I like Pema Chodron's teachings. She's a mindfulness. She's a Buddhist teacher, or Tara Brach. So I weave in all these pieces of wisdom, and somebody may not be able to hear that. Then I do behavior change. It really depends on the person, what they're ready to embrace.
Do you find that people, once they've decided to go with someone like you, that they're fully engaged and they change relatively quickly?
I would say the 3-month mark is a differentiator. I see a shift in clients in about 12 weeks, where they start putting their needs first, not swallowing their truth and eating their emotions. But it takes a while. There is no quick fix. So I would say, give me 3 months minimum. and then renew. Most clients do 6 months. I have had clients for a year now, and it takes a while. If you've been doing something for 20 or 30 years, it doesn't go away in 4 weeks. And this whole myth, you can change a habit in 3 weeks, I've never found research that confirms that. You can maybe make a dent, but to make it stick, it takes longer.
Yeah.
Yeah.
I think it's what's interesting right now with the medications out there for weight loss is they're doing other things as well. They're giving people more, mental clarity, less brain fog.
Yes.
Any people that have autoimmune diseases, they're helping with those.
Yes.
And I mean, it's pretty unbelievable.
I think Western medicine is a miracle too. So we need to discern and just apply depending on the person, what serves somebody best. And I mean,
right. And then with those patients, with a lot of our patients that are taking it seriously with what they're putting in their body and things like that.
Yes.
I mean, too, sometimes, like I have a friend, she'll say, "Oh, I've been so good. I had a glass of wine and French fry, whatever." I think it was even Honor Bar, actually. She said,
seems to be the spot.
And so the funny thing about Honor Bar is we met someone, a restaurant owner in town that had someone that used to work at Honor Bar, then come and work for him, and she said that they put sugar in
extra sugar in
sugar in everything they do, which is why people get addicted to Honor Bar.
Oh,
it's interesting.
Why people like Honor Bar so much?
Yeah.
Okay.
They like to go there a lot because it's in everything.
Oh my God. Yeah, I'm sure. I mean, eating out.
But I don't like it very much.
What do you like?
I like Honor Bar, but I think about the sugar every time I go in there.
I like the spot by the fire pit outside. That's the only, if it's available, that's where I sit.
Yeah.
I use.
But what about that? Like, oh, I've been so good, I'm gonna go have.
Great question. Here's the thing. The key differentiator is, am I celebrating or self-medicating? That's all you need to think about.
Celebrating.
Yeah. Then enjoy it.
Or maybe self-medicating. No, she was celebrating.
So if I do that, I never feel guilty. If I go there and say, "Oh man, this is amazing. I love it." Planning for mindful indulgences is key. Don't go for the cheap stuff. Get the best chocolate. Get the best pastry. Yeah. And enjoy it.
Yeah.
Food is to be enjoyed, not
That's
feared.
how I am with wine. If the wine, I don't like it, I'm not going to drink it. Good. It has to be, or I don't really want it. But you do the. I've had
to see what's going to come out.
Oh yeah. No, so like if it's been like a kind of crazy day at work, Duncan is already planning on going to the Lion's Tail bar across the street to get his Vesper martini and French fries.
Is it good?
It's really good.
Do you enjoy it?
I love it.
There you go.
They do the best steak frit, or you like their steak frit, or steak
bite.
They do this huge thing of French fries.
With a little bit of filet mignon.
With filet mignon inside of it.
Let's go there.
That's a happy hour thing.
I didn't know. Good to know. Thank you.
To go, but so I don't know. What is that for you, Duncan? Is that
it's reward?
See, this is turning into a therapy session for him.
No. Or are you self-medicating?
No, I'm not self-medicating.
No. Okay.
Good.
No, not.
All right.
And sometimes, here's the kicker, sometimes we do self-medicate, and that's okay.
Yeah.
If it's a pattern over time that is becoming harmful, then we should look at it.
Yeah.
With compassion and say, ooh, I need to step off this path. If I want to live a long, vital life, vitality, longevity, these are the things we're interested in, at least at my age. And so, but enjoying a good meal it's wonderful.
Yeah.
So I don't think you have a problem there.
I don't think I have a problem with the whale's tail at all.
Whale's tail?
Right. Sorry. The Whale's Tail was the name of a restaurant in
Ventura?
In Tofino. Well, maybe. It's probably all over the world, but it was...
We're going to call it now the Whale's
Tail.
Okay.
Whale's Tail. That's
the Lion's Tail.
Yeah. I used to teach, if I can just briefly... I've not always worked at clinics. Do you guys know the Golden Door Resort?
Oh, yeah.
I worked there for a half a year with high achievers. They only allow 40 people at a time on 600 acres. It's like a Buddhist monastery.
They were like the OG, the original wellness.
Correct. And
so in Arizona?
No, this one is in San Marcos. Canyon Ranch is the sister property, I think. But my point is, 40 women would show up. I would give my initial spiel at the first evening meeting. High achievers, successful women. And I would ask, who in this room is good at taking care of everyone else? Well, 40 hands went up. Then I would ask, and who is good at doing this for herself? How many hands do you think went up?
Very few.
Two or three,
mm-hmm.
Yes.
Yeah.
So self-nurturing, emotional self-care, honoring your true needs, and speaking up is important. Emotional eating has many layers. And so I developed this visual, I didn't bring it, called the emotional eating iceberg, where diets and weight loss are above the surface of the water, but underneath the body of the iceberg is all the emotions that contribute to emotional eating. That's where the work lies, that I do.
Mm-hmm.
Yeah.
Yeah.
It's very important.
Thank you.
Yeah.
Good. I love it.
I mean, I have a daughter who's now 21, and I'm watching her, navigate food, and I'm trying to be very supportive, and she tends to be a little OCD, like we all do, but some of the things that I've witnessed, she was just home for a month, were a little like too regimented for me. And I don't know if she's kind of witnessed that with him and maybe is doing it because it's what you do, but it is an extreme intermittent fast with definite rules attached to it.
Yeah.
And when I took her back to school, this was just the other day, my parting words were, life is short and you're regimented, you're doing great, but, enjoy your life. Enjoy your life. You're 21.
Yes.
If you want to wake up and have your coffee. You don't need to wait till noon.
No,
because you're trying to get your fast. You know what I mean? It's not going to matter.
I don't like rules or rigidity around food at all.
Yeah, and I'm seeing that there is a lot with this younger generation. And they're so young, and it's like
social media.
Not healthy, I don't think, to have that at her age. I don't know.
Well, maybe you can help her over time.
Yeah. But again, it's just the relationship. What is it that what story is there for you?
Correct.
With that.
Yes.
And
what story?
Yeah,
You're
what
right.
story?
Yes.
And
I'm glad you're teaching her this, because the majority of my clients got very negative and detrimental messages. That they were fat, they took them to Weight Watchers. And then I said, show me a picture of when you were little. The kids looked fine.
Yeah.
The kids looked fine, honestly.
Yeah.
So in my work, I have them bring out that picture. And one of my clients frames it, and I go to her house, and it's always there. And it reminds her to take good care of that little girl, And becoming the person we needed the most is also what I help others with.
That's great. Yeah. I mean, I do think it is loving yourself. And what does that look like? Because people don't think about that.
No.
So.
Yeah. And throwing out these big words right away, I may not want to do that. I'm very intuitive. And one of my gifts is I make people feel safe. Because I know what it's like not to feel safe. So it's so important, having compassion for change and not knowing how to get to the other side. I know, I've done that. I've been there. And so I'm a very compassionate, warm counselor, and effective too. I want to say I'm really good at what I do.
That's great.
Good for you.
Yes.
Absolutely.
Now, this is really my life's work. And it has, since I worked for you many, many years ago, I've changed, and I have...
It sounds like it, yeah.
Yeah. Mm-hmm. And done a lot of work on myself, inner healing, and, how I do life now is very different.
Good. And I was amused by the fun fact about you that you consider yourself a recovered type A.
Yes.
German woman. I think you have to explain that.
Yes. So you noticed that I didn't let you know that I'm recovering. I am recovered. Germans are driven, at least where I grew up, all the people I know. I have friends in Munich. He has a MD, has a doctor, he's an MD, and also a business consultant. He got his MBA. And his wife, my best friend, is also a physician. And I hope they don't listen to this. But when I come home, I shower off the day and I'm in loungewear. When they come home, he goes upstairs, and instead of the iron shirt, he maybe puts another semi-iron shirt on and comes down in the same outfit. Germans are, as we know, many are high achievers. And coming to California, for me, to Santa Barbara, has helped me embrace lightness a little bit more. I can turn on that type A behavior if needed for a project, but man, I can unplug and do absolutely nothing. Great. I did a TEDx interview with Max Sylvester on the sweetness of doing nothing, la dolce far niente, what we can learn from the Italians. Americans don't know how to do that. That's what I'm finding.
No, that's my problem. Yeah.
I can help you.
We'll take you up on that.
Yeah, please, anytime. Yeah. No, I'm really, and I see friends, they don't sit still. So, yeah, that's what I mean by recovered type A.
I think that's great.
Thank you. It took some work.
Yeah.
Well, Petra, I really feel that we can work together, and I think you have some very significant tools to offer.
Yeah, I appreciate that. Yeah. Likewise. I mean, yeah.
And it's really, the GLP-1 medications have been so helpful, but there has always been this, well, what do we do now?
Always.
When they get to where they want to be. And so, microdosing, I think, is a good way to do it. And there are more and more benefits that we're discovering with the GLP-1 agonists. But I think some therapy is still very valuable. It's
good to have more tools in the toolbox and more resources if needed, right? That's all we're saying.
Yeah.
So thank you.
Thank you. It was a pleasure. Thanks so much for having me.
Always good seeing you.
You too. Thank you.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.